I would say grinding is one of those questions that we get constantly. It can be very noisy and very alarming to hear your child grinding. And I do want to talk a little bit about grinding and its etiology and the limitations of what we know. About 75% of kids, elementary aged, is our best sample, show some signs of grinding at some point. And so we know that there is some range of like normal development that includes grinding. Prevailing theory on that right now is that as teeth are growing and changing, there's a lot of discomfort, and it can be soothing to grind the teeth. And so think of it a little bit like some growing pains. And one of the things that helps with growing pains, like for muscle growth and bone growth, is moving around. And kind of the same could be said for grinding teeth. So kids that are losing teeth, getting new teeth, it kind of just helps them out to kind of grind things around, move things around. That there is some subset of the population that grinds and it's considered normal, and as the grown-up teeth come in, they stop grinding. That's a big chunk of kids. Then you also have kids who are seeking stimulation, and those kids are grinding because it is stimulating and they want that sensory input. And so typically that's what we see in children with special healthcare needs. They're looking for sensory input and they're grinding their teeth to get that. And so there's this subset of the population that is grinding for sensory input. We also know that muscle tension, stress can all contribute to grinding. So when we put that together, we know that some of it's normal, some of it's pathologic. We're always trying to tease out who's doing what. And it can also indicate some airway issues. So when we're looking at the grinding, we're trying to determine, is this together with a constellation of other airway symptoms, or is this the only symptom that could be linked to an airway problem? If it's the only symptom and I'm seeing it in total isolation and there's some other explanation that I can come up with, then I'm not going to be assuming that it's an airway problem. But at the same time, we always want to go through our checklist and have those discussions to make sure that we're identifying if it's part of this larger, bigger picture. Another thing about grinding that I think is really interesting is that some kids, I don't know exactly how they do it, but they grind loudly, but they have no damage to their teeth. Those kids, you look at their teeth and the peaks of their teeth are perfect. There's no wear at all. They do not look ground down. They do not look overused. They just look perfect. For those kids, like there's no damage that's being caused. So I have zero concern about their grinding unless they're in conjunction with these other symptoms that are concerning. I would say there's not a one-to-one relationship. Grinding equals bad, and it's definitely not a relationship like grinding equals airway problem. We kind of have to go through and be a detective and investigate what symptoms are we seeing and what problems are arising, and are any of those problems concerning, and what are the potential consequences of those problems. So it really is a lot more complex than you'd think, but we do a lot of evaluating and very careful examination of the teeth whenever we know that a kid has been grinding, and then that helps us put together a picture of what's going on.